If your provider suggests inducing labor, here's what that usually means, and why they might bring it up. Induction means I start labor with medical help instead of waiting for it to begin on its own. Inside the 3D anatomy, think cervix, uterus, placenta, baby. The cervix softens and opens. The uterus contracts rhythmically. The placenta delivers oxygen. When one part isn't keeping pace, especially late in pregnancy, induction can tip the balance toward a safer birth. Common reasons. Post-term pregnancy, around 41 to 42 weeks, the placenta can age and deliver less oxygen. Induction reduces the risk of stillbirth and complications. Water broken, no labor. Once membranes rupture, infection risk rises the longer I wait. High blood pressure or preeclampsia. Induction can prevent organ complications for me and stress for the baby. Concerns about the placenta or baby. Too little amniotic fluid. Growth restriction. Non-reassuring testing. Cholestasis. Medical conditions. Some diabetes or other issues may make earlier delivery safer depending on my situation. How induction works. Step 1 is often cervical ripening. If my cervix is firm and closed, it's less ready. Providers might use prostaglandin gel or a tiny balloon catheter to gently open and soften the cervix. Next, they may break my water, called amniotomy, to release fluid and encourage contractions. Oxytocin, a hormone drip, can guide steady, effective contractions while the baby's heart rate is monitored. Sometimes a membrane sweep in the office can nudge things along before a full induction. Potential benefits: lowering risks linked to going too far past the due date, preventing worsening blood pressure disorders, reducing infection after the water breaks, protecting a baby who isn't tolerating the womb well. Possible downsides: stronger, longer contractions, need for continuous monitoring, interventions like IVs, and in some cases a higher chance of needing assisted delivery or a cesarean. Though at around 39 weeks for some first-time pregnancies, induction doesn't necessarily raise C-section risk. Questions to ask. Why do you recommend induction for me, and why now? What's my Bishop score? How ready is my cervix? Which methods will you use, and how long might it take? How will pain be managed? How will my baby be monitored? And what's plan B if progress stalls? Induction is a tool to balance risks for me and my baby. I can bring my preferences, birth plan, and support person, and make choices with my provider.